Great. Thank you, Chairwoman Button, and thank you for inviting us here today and the entire IRED committee. My name is Kim Kofron. I'm with Children at Risk. And thank you for prioritizing early childhood education and the entire child care industry in this interim hearing. The pandemic has reminded us that a strong, robust, high-quality child care system is vital to the overall Texas economy. As someone who has worked in the child care system for many decades, low wages and high turnover has always been a part of our lives of child care workers in Texas. However, the pandemic has brought to the forefront just how critical child care is to the rest of the economy. It's hard to go a day without seeing an article regarding the situation families with young children are in, or child care providers themselves in the local or national news. When the world shut down in March of 2020, child care programs across Texas continued to care for children and their families. First responders had to work, medical professionals had to work. Texans still needed child care. However, the last 2 years have not been easy. According to the data from the child care regulations of the Texas Health and Human Services Commission, Texas has lost about 21% of child care providers from March of 2020 through September of 21. Out of those closed programs, 41% of those providers cared for our infants and toddlers. 79% of them were child care homes, which disproportionately affects rural communities, communities of color, and families that need non-traditional hours of care. When we look at the actual number of possible enrollment, in 2019, we had about 87 child care spots per 100 children for working parents. In 2021, we have 54.9 seats per 100 children. That's a 37% drop in availability for working families. Since the beginning of the pandemic until September of 21, we had 242 communities grow in child care deserts. That's a 62% increase increase of child care deserts statewide since the start of the pandemic. Yet we know there's a couple factors that made a big difference in child care providers staying in business. The Texas Workforce Commission's Texas Rising Star program, which supports quality programs, and the COVID relief stabilization grants from the federal government, which is also administered by the Texas Workforce Commission. Out of all the providers that closed, only 2.9% of them were Texas Rising Star programs, and 98.4% of the programs who received the first round of stabilization grants last summer of 21, remained open. However, these two factors alone are not enough to ease the struggles of child care providers when it comes to staffing crises that affect the entire labor market. According to the National Survey of Child Care Providers by the National Association for the Education of Young Children, 2/3 of the respondents reported experiencing staffing shortages that affected their ability to serve families. 52% of them with staffing shortages that were forced to serve fewer children, and 37% had longer waiting lists. Therefore, child care providers that did stay open are not necessarily at full capacity because they don't have the proper staff to care for children and operate their business. We will hear today from providers on the very real struggle to maintain their workforce. As a reminder, the median annual wage for a child care educator in Texas is roughly $20,000 a year. It's about $10.15 an hour, resulting in 56% of our educators qualifying themselves for at least one form of public assistance. Current child care relief funds are helping providers to pay their educators more. However, it's not a permanent fix. Providers are already concerned about maintaining higher wages once those federal funds run out. And as other employers have seen, even with the relief funds, providers aren't able to pay those competitive wages that other markets are able to. It's not an exaggeration to say that the men and women at Texas Workforce Commission have had a large hand in saving the Texas child care industry during the pandemic, and they deserve our thanks and appreciation. We could not have asked for better leadership at TWC. The last 2 years have been nonstop for child care providers, but also for TWC, from their first response to the initial effects of the pandemic, to their thoughtful and innovative spending of the COVID relief dollars, and now to implementing those ideas. We're continually thankful for their partnership, for their forward thinking and striving to put children, families, and the child care providers first in their decision making. We are also grateful to the rapid response of you, Madam Chair, and this entire committee and the legislation last session. You saw that the child care providers were struggling, and you acted decisively and quickly. The passage of the landmark bills that were included in today's hearing helped Texas prepare for the challenges of supporting our employers, our parents, and most importantly, our children. Texas is moving Texas in the right direction. Sometimes I think there was a crystal ball with the timing of HB 2607 and HB 619. Could not have been at a more perfect time as we are in this current workforce crisis. I, along with many of my very brilliant colleagues, have the privilege of participating in the HB 619 stakeholder work group, where we're studying and making suggestions on the strategic plan to address the issues around the early child workforce. We are looking forward to that continued work throughout this year and the report to follow. HB 2607 is also being implemented at a time that TWC and the local workforce boards have extra dollars from the Child Care Relief Funds to put extra supports and resources in helping providers start their Texas Rising Star journey. The data is clear. Texas Rising Star works for children and providers to support providers, and Texas Rising Star works for children and provided the supports providers needed to keep their doors open to serve children and families. But you're right, we're not done. We have more to do. So as we look forward to the 88th legislative session, what other things are we thinking about, and how can we improve the system? We need to continue to support and strengthen the early childhood workforce through compensation and education. If we want to not only keep our current child care workforce, but build that pipeline for future educators to come into this field, we need to make sure it has that viable, livable wage. We also need to remove barriers and incentive of partnerships between the ISDs and the high-quality child care providers. One of the barriers that these public-private partnerships is a different eligibility criteria for the two different programs. If we are able to align those eligibility enrollment requirements for children enrolled in those two programs, that will give more families choices and more support to those partnerships in general. We also need to think about improving access to that quality child care across all settings. Quality child care is important to all families and should not be determined by the type of program a family chooses. We need to think about the system holistically for children birth through age 5 across settings. So if that's public schools, child care, family child care, faith-based programs, early Head Start, and charter schools, families should be able to determine what setting is best for their individual child. This is also a need to explore how to build consistencies across the states with varying local workforce boards. We recently held focus groups with Texas Rising Star providers and non-Texas Rising Star providers regarding their participation or lack of participation in Texas Rising Star. And one of the frustrations that came up was the inconsistency across the local workforce boards on the level of supports and resources available from one provider in one workforce board versus another. Additional.
Can you elaborate a little bit? When you say
elaborate a little bit?
Yeah, inconsistency. Yeah.
So right. So and I know Reagan Miller will talk about this too, but so the Texas Workforce Commission has the Texas Rising Star systems, but then local workforce board also has choices on how they spend their quality dollars and how they do their supports, how many times a mentor may come out to support a center before doing their Texas Rising Star assessment. All that varies depending on the local workforce board. And so how do we build that consistency across the state to make sure all providers are getting what they need?
Yeah, well, that was one of the main reasons we want to standardize the evaluation process.
Right.
So you still see the barriers over there?
The tools are the same, right? So the TRS tools, the criteria that everybody looks at, the implementation is where that variation may difference on the supports that providers will get.
Okay, so this is implementation.
Correct.
Okay.
Right. Just two more. The other one is to continue to increase the reimbursement rates for the child care providers who are providing high quality care. We are so thankful for TWC's leadership in raising the base rates as well as the Texas Rising Star level rates in October of 21. However, more needs to be done. If providers charge less than the published reimbursement rate, the law requires them to reimburse at that lower rate. So for example, if a provider is charging $25 a day for a toddler because she's in a low-income area, but the reimbursement rate for that toddler is $35. She's still reimbursed at that $25 because that's her published rate. So in effect, we're punishing providers that are in low-income areas for serving that community. We also need to look at how a state sets our reimbursement rate. We currently set our rates based on a market rate survey. The state surveys providers across the state, looks at the different workforce board areas, and determines those rates. But the issue with this is that child care providers are unable to charge families what it truly costs to provide high quality care. The state should look at using potentially alternative methodologies that looks at the true cost of care and determine reimbursement rates based on those calculations. And the final is to really think about investing state dollars into child care. So where does the money come from? That's a very good question. We know that there are two pieces of legislation in Congress at the moment, one authored by Democrats, the other authored by Republicans, but we're not sure if that will happen and what that will look like. Therefore, it is time for us as Texans to start having the conversation around how do we invest in our own children, our own families, to ensure they not only have high quality learning experiences, but their parents are able to work and their early childhood educators are compensated and respected for their profession and expertise. Early childhood education is important for children and for the Texas economy to thrive. I thank you for your time, and again, you appreciate all of what you do for our industry, and we're happy to answer any questions.